Right now, I want you to do something for me. Walk to your kitchen, open the cabinet where you keep your spices, and just look at what's in there. Cinnamon, garlic powder, turmeric, maybe some cayenne, some cardamom, a little ginger. Bottles you've probably had for years. Spices you reach for without thinking. The ones that make your food taste like something instead of nothing. You've used them hundreds of times. You've sprinkled them into soups, rubbed them onto chicken, stirred them into sauces. And every single time you did that, you thought you were just adding flavor. You had no idea you were also doing something else entirely, something that your doctor has almost certainly never taken the time to sit down and explain to you. Something that changes the conversation about blood pressure in a way that most people over 60 have never heard. Because here is the truth that is sitting right there in your spice cabinet, waiting for you to understand it. Every single one of those bottles contains compounds that act directly on your cardiovascular system. Not metaphorically, not loosely, directly, measurably, in ways that clinical research involving real patients with real hypertension has now documented across dozens of published studies. And what those studies found will genuinely surprise you. The research shows that certain spices, ordinary spices that cost less than a few dollars at any grocery store, have produced reductions in blood pressure in clinical settings that are comparable to what some commonly prescribed medications achieve. Let that land for a moment. The same outcome that billions of dollars in pharmaceutical research has been chasing for decades is partially, meaningfully reachable through what is sitting in your kitchen right now. And yet, if you're like the vast majority of people I have spoken with over the course of my career, nobody on your medical team has ever mentioned a word of this to you. Not your cardiologist, not your internist, not your pharmacist. The conversation about food and spices and their real, documented effects on cardiovascular health has been left out of the exam room almost entirely. That stops today, right here in this video, because what you do not know about those little bottles in your cabinet is costing you something, and I believe you deserve to know. My name is Dr. Sandra Whitmore. I am a cardiologist, and I have been practicing cardiovascular medicine for over 23 years. In that time, I have worked with thousands of patients managing blood pressure with varying degrees of success. I have seen what works and what does not. I have sat across from people who were doing everything they were told and still watching their numbers climb year after year. People who were frustrated, confused, and honestly a little afraid. And I have also sat across from people whose numbers moved in the right direction, not because we added another prescription, but because we started paying attention to something the medical conversation had been ignoring. What I have found consistently across more than 2 decades of patient care is that the gap between what the research actually shows and what patients are actually told can be staggering. And nowhere is that gap wider than in the conversation about food, about spices, and about how powerfully they can influence the cardiovascular system. If this channel is new to you, please take a moment right now and subscribe. Your heart needs what you're going to learn in this video today, and there is a great deal more coming after this. Today, I'm going to walk you through 7 specific spices, not exotic, hard-to-find, expensive supplements, spices that are sitting in kitchens all across this country right now, spices that clinical research has directly connected to meaningful, measurable reductions in blood pressure. I'm going to explain exactly how each one works inside your body, and I mean really explain it, not in vague, feel-good language, but in clear, honest terms that help you understand what is actually happening at the level of your arteries and your blood vessels when you consume these things. I'm also going to share stories from real patients, people over 60 just like you, whose numbers changed in ways that genuinely surprised me. And I'm going to give you practical, honest guidance on how to actually use these spices in your daily life without overhauling everything you eat. Before we begin, I want to be clear about something important. This is not about replacing your medications. That is a conversation you have with your physician. But this is absolutely about understanding what is available to you right now in your own kitchen for pennies that the pharmaceutical conversation has a long habit of leaving out. So let us begin. Let's start with the most extensively studied spice in the entire cardiovascular literature, the one with the most human clinical trials behind it, the most consistent research findings, and honestly, the most impressive results. Garlic. Now, I know what you're thinking. You've heard about garlic your whole life. Your grandmother told you garlic was good for you. Your parents probably said the same thing. And somewhere along the way, you may have filed that as folk wisdom, the kind of thing people believed before we had real science, before we had laboratories and clinical trials and peer-reviewed journals. I'm here to tell you something important. In this particular case, your grandmother was more right than she knew. And the science doesn't just support her, it backs her up completely with numbers that would satisfy any skeptic in any cardiology department in this country. Here is what is actually happening inside your body when you consume garlic. Garlic contains a compound called allicin, which is produced when garlic is crushed or chopped. Allicin is a sulfur-containing molecule with a remarkable property. It acts as a natural inhibitor of angiotensin-converting enzyme, the same enzyme that ACE inhibitor medications are specifically designed to block. If you're on blood pressure medication, there's a reasonable chance you're already taking an ACE inhibitor. Doctors prescribe them because when ACE is inhibited, your blood vessels receive less of the chemical signal that tells them to constrict. They stay open. They stay relaxed. Blood flows through them more freely, and pressure drops. What garlic does is work on that same pathway, the same biological mechanism through a natural compound that your body recognizes and responds to. But allicin doesn't stop there, and this is where it gets especially interesting. Research has also shown that the compounds derived from garlic increase the production of nitric oxide in your arterial walls. Nitric oxide is your body's built-in vascular relaxant. More nitric oxide means more arterial dilation. More dilation means lower pressure. And these two mechanisms, the ACE inhibition and the nitric oxide boost, work simultaneously, which is why the research on garlic is so remarkably consistent. A review of 12 separate clinical studies involving over 550 people with diagnosed high blood pressure found that consuming garlic produced an average reduction of 8.3 millimeters of mercury in systolic pressure, which is your top number, and 5.5 millimeters in diastolic pressure, which is your bottom number. I want you to sit with that for a moment, because those are not trivial numbers. That is a clinically significant reduction. To put it in context, those results are comparable to what some low-dose ACE inhibitor medications achieve in similar patient populations. And we are talking about a spice, something that costs less than $1 a head at any grocery store in America, something you can add to almost any meal you're already making. The gap between how powerful this evidence is and how rarely doctors mention it to their patients is, frankly, one of the things that motivated me to create this channel. Let me tell you about Raymond. Raymond was 64 years old, a retired firefighter from Nashville, Tennessee, 31 years on the job. He was the kind of man who had spent his entire career running toward situations that most people run away from. And he approached his health with that same stoic determination, which in practice meant he did not like talking about it and he did not like taking pills. When Raymond came to see me, his blood pressure was 156/94. He was on one medication that he took inconsistently because it made him feel tired and sluggish, in a way he described as not like himself. His wife had been after him to come in for 2 years. He finally came in, sat down across from me, and the first thing he said was, "Is there anything that actually works that isn't a pill?" I told Raymond about garlic. Not garlic supplements, not powder, not extract, not capsules. Fresh garlic incorporated into his cooking daily. 3 to 4 cloves, crushed or finely chopped, added to his meals. Not raw if he did not enjoy it that way, because cooking is fine, though lighter cooking preserves more of the active compounds than extended high heat. Raymond grew up in Tennessee. He knew how to cook. Garlic was not a foreign concept to him. We just made his use of it consistent and intentional. 6 weeks later, Raymond's home blood pressure monitor was reading 143/86. We had not adjusted his medication. His physician was honestly a little skeptical until he saw the numbers himself. 14 points on the systolic, 8 points on the diastolic for making one deliberate dietary addition, consistent, one thing. Raymond called my office to share that update, and what he said, the sentence I remember most from that conversation, was not about the numbers at all. He said, "I feel like myself again." For a man who had spent 31 years showing up for other people in their worst moments, hearing himself say that he felt like himself again because of something he was doing for his own health, that stayed with me. That is the kind of outcome that reminds me why this work matters. The second spice on this list shares something fascinating with garlic. It also works through more than one blood pressure pathway simultaneously, and one of those pathways targets the same mechanism as a specific class of prescription medications. That spice is ginger. The active compounds in fresh and dried ginger, substances called gingerols, shigalls, and zingerone, work on your cardiovascular system through two distinct but complementary mechanisms. The first is that they act as natural calcium channel blockers. Your arterial walls are lined with smooth muscle cells that tighten and relax based on calcium ion movement through specialized channels. When those channels allow too much calcium in, the muscle cells contract, your arteries tighten, and your pressure rises. Ginger's active compounds interfere with that calcium entry. The muscle cells stay calmer, the arteries stay more open, pressure has fewer reasons to climb. Calcium channel blockers are an entire category of blood pressure medication prescribed to millions of people. Ginger does something chemically similar naturally. But ginger's second mechanism is equally important. Its active compounds also appear to inhibit angiotensin-converting enzyme, the same pathway that garlic targets and the same target as the ACE inhibitor class of blood pressure drugs. So what you have in ginger is a single root that simultaneously does what a calcium channel blocker does and what an ACE inhibitor does. That is two distinct pharmacological mechanisms working together in one ingredient that grows in the ground. A published meta-analysis examining 6 randomized clinical trials specifically looking at ginger and blood pressure found that consistent ginger consumption reduced systolic blood pressure on average by an average of 6 millimeters of mercury in systolic, which is your top number, and approximately 2 millimeters in diastolic, which is your bottom number. That is not a dramatic amount. That is a pinch you can add to your morning oatmeal or your evening soup without even thinking about it. Dorothy was 71 years old, a retired school teacher from Charleston, South Carolina, where she had taught 5th grade for 34 years. She came to me with blood pressure consistently in the 148/90 range across multiple readings. She was not on medication yet, but she was close. She also had arthritis in her hands and knees, common in women her age, and she had been managing that discomfort with over-the-counter anti-inflammatory medications on a regular basis. Here's something that I want to address directly, because many seniors are simply not aware of it. Certain common over-the-counter pain relievers, particularly the non-steroidal anti-inflammatory drugs, the NSAIDs, can raise blood pressure, especially with regular use. Dorothy had been taking these for her joints for over a year without understanding that they were likely contributing to her elevated readings. She had 2 problems feeding each other, and she didn't know either one was connected to the other. We addressed both problems simultaneously. For the arthritis, we incorporated ginger into her daily diet. Fresh ginger in her tea every morning, ground ginger in her cooking in the evenings. Ginger is a well-validated natural anti-inflammatory, and the same compounds that act on her blood vessels also reduce the inflammatory markers that drive joint discomfort. Over 8 weeks, Dorothy gradually reduced her reliance on those pain medications while simultaneously watching her blood pressure move downward. At her next checkup, she was reading 134/82. Her arthritis had not disappeared, but it had become, in her words, manageable without needing a pill every single day. 2 problems, 1 kitchen ingredient. I cannot promise that kind of outcome for everyone, but when it happens, it's genuinely difficult not to find it remarkable. And the underlying science that made it possible isn't magic, it's just biochemistry that the medical conversation forgot to mention. Now let's talk about a spice that most people over 60 grew up associating with warmth, comfort, and the smell of something sweet baking in the oven. Something familiar, something that takes you back to childhood kitchens and holiday mornings: cinnamon. The primary bioactive compound in cinnamon responsible for its cardiovascular effects is called cinnamaldehyde. And here's what cinnamaldehyde does inside your body. It acts directly on the smooth muscle cells lining your artery walls and causes them to relax. This is called vasodilation, the widening of blood vessels, and it is the same fundamental outcome that many blood pressure medications are engineered to produce. Cinnamaldehyde achieves this partly by interfering with calcium influx into those smooth muscle cells, similar to ginger's mechanism, and partly by working through the endothelium, the thin inner lining of your arteries, to reduce the tension those walls hold at rest. Research also shows that cinnamon phytochemicals interact with the renin-angiotensin system, the regulatory network that governs whether your blood vessels stay constricted or dilated. A review of 9 clinical studies involving 641 participants found that consistent cinnamon consumption reduced systolic blood pressure by an average of 6.2 millimeters of mercury and diastolic pressure by approximately 3.9 millimeters, both numbers moving in the right direction. And this was cinnamon consumed as a spice added to real food, not a lab extract, not a pharmaceutical-grade supplement, just cinnamon. Frank was 68 years old, a retired postal worker from Minneapolis, Minnesota, who walked his mail route on foot for over 30 years through winters that most of the country can barely imagine. He was one of the most physically active patients over 60 I had ever evaluated. He walked regularly, he gardened, he was not overweight, he did not drink, he did not smoke, and his blood pressure was 152/91. Frank's case reminded me of something I encounter more often than people expect: patients who do everything right by the conventional checklist and still cannot get their numbers where they need to be. Exercise, check. Healthy weight, check. No bad habits whatsoever, check. And yet, the cardiovascular system is still running above the line. It is frustrating for patients, and it should push physicians to look deeper instead of simply reaching for the prescription pad. When I reviewed Frank's diet in detail, the picture clarified quickly. He was eating reasonably well, but he was eating a narrow and repetitive selection of foods that happened to be low in the specific bioactive compounds his arteries needed. He was not eating fresh garlic. He was not using turmeric or ginger. His spice cabinet, he told me with a slightly embarrassed shrug, was basically salt, pepper, and Italian seasoning. I introduced Frank to cinnamon as a daily addition, specifically half a teaspoon of Ceylon cinnamon stirred into his morning oatmeal, which he ate every single day without fail. This distinction matters, and I want you to hear it clearly. Ceylon cinnamon, the lighter-colored variety often sold in specialty grocery stores and widely available online, is the preferred form for daily regular consumption because it contains significantly lower levels of a compound called coumarin. In very high daily amounts, coumarin from the more common cassia cinnamon variety can place strain on the liver over time. For occasional cooking, cassia cinnamon is perfectly fine. For a daily therapeutic dose, Ceylon is the wiser and safer choice. Frank maintained this single addition consistently for 9 weeks. At his next formal evaluation, his blood pressure came in at 139/84, 13 points on the systolic side, from oatmeal. That is the kind of result that makes the simplicity of this approach feel almost unfair in the best possible way. Because Frank did not overhaul his diet, he did not start a new exercise program, he did not add a new medication, he added half a teaspoon of the right kind of cinnamon to a breakfast he was already eating every morning. The compound was already available, the breakfast was already happening. All that was missing was the knowledge to connect them. That knowledge gap is exactly what this channel exists to close. If you've been paying any attention to health conversations over the past decade, you've almost certainly heard about turmeric. It's had an enormous cultural moment. It's in lattes, in supplements, in face creams, in everything. And I'll be completely honest with you, as I always try to be. Much of what gets said about turmeric in popular media is overstated, oversimplified, or attached to claims that go well beyond what the actual research supports. But here's what the research genuinely does show, specifically about blood pressure.
stated clearly and honestly, and it is absolutely worth understanding. The primary bioactive compound in turmeric is curcumin, and curcumin works on your blood pressure through a mechanism that is distinct from everything else I've described so far, one that is increasingly understood to be central to why so many people develop progressively worsening hypertension as they get older. Curcumin works primarily through the endothelium, that thin inner lining of your arteries that I mentioned earlier. It is not just a passive tube, it is a biochemically active layer of cells that produces nitric oxide, regulates the tone of your vessel walls, and serves as essentially the control interface between your bloodstream and your arterial muscle. As we age, that endothelial layer becomes increasingly dysfunctional. It produces less nitric oxide, it becomes more reactive to inflammatory signals, it becomes, in clinical terms, stiffer and less responsive. And when your endothelium is not functioning well, your arteries can't relax the way they need to, and blood pressure creeps steadily upward year after year in a process that feels inevitable, but is not. Curcumin research, including a study tracking the effects of 12 weeks of curcumin supplementation on artery function, found meaningful improvements in endothelial function, specifically measured through increased nitric oxide bioavailability and reduced markers of oxidative stress inside the vessel walls. The arterial lining became more responsive, more capable of producing the molecular signals that tell blood vessels to stay open and pliable.